Hi, my name is Tom Hoke, and I'm a patient at the Temple Bone Marrow Transplant Program. I was diagnosed with acute myelogenous leukemia in August of 2006 back at my home hospital in Reading, Pennsylvania. In 2003, I had a different form of cancer and was treated by my oncologist in Reading and had a lot of trust and faith in him for the way he handled my situation. And then subsequently in 2006, when I was diagnosed with leukemia, the first words out of my Reading doctor's mouth were, "I'm going to call Dr. Mangan down at Temple." And in January of 2007, I had my stem cell transplant here at the Temple Bone Marrow Transplant Program. When I was first diagnosed with leukemia, obviously I had heard the term before, but I didn't realize the severity and the impact it could have on someone's life. When I started hearing the term stem cell transplant, I equated that with the political hot button, the embryonic stem cells. I had no knowledge whatsoever of the complexity and the possibilities there are with stem cell transplants, because I think there is not enough public awareness about the whole process. And I'm a perfect example. I really knew nothing about it before it hit me personally. Initially it was scary, obviously, which I'm sure most people experience. You're going into the unknown and maybe things you don't want to hear or comfortable hearing. But my family and I cannot say enough about the staff down here. Everyone, the doctors, the nurses, the receptionists, they couldn't have made us feel more comfortable, and to this day and forever we will consider them as family. It's about an hour and a half travel time down here to Temple. We were afforded the availability of temporary housing down here, apartments from the staff at the Bone Marrow program, but we elected to commute. I guess I kind of had the best of both worlds, again because of the referral from my doctor in Reading. And after meeting the staff down here at Temple, I felt completely comfortable and secure in what they were telling me, and I had no reservations. The transplant was very interesting. I can't think of the right word. The actual transplant itself on that day in January of 2007 was almost as simple as a blood transfusion as far as the mechanics of the transplant. But on the other hand, there was something so huge going on in my life. It was just mind-boggling. About 6 months after the transplant, I started to experience some graft versus host disease, and which progressively got worse, and I needed to be readmitted down here at the Temple Bone Marrow program. It was overwhelming, to say the least, but the staff was incredibly supportive of me and my family, and I can't say enough about that. I respect Dr. Mangan as the day is long. When I first met him, I thought he was kind of imposing because he had to be the one to give me the news that I was about to receive. Things were close on 3 occasions, very close, that they called my wife down, and she relayed to me how he treated her and handled her when he had to tell her the possible impending outcome of my situation. And to this day she talks about how, again, his bedside manner, how he spoke with her professionally yet compassionately at the same time. I had an allogenic stem cell transplant. I have one sibling, a sister, and they tested her for a match, and unfortunately she was not a match for me. So they went into the national registry and they found a 10 out of 10 match. I've come to know that this man lives in San Jose, California. I have not personally met him yet, but we have communicated by telephone and email, and so we do keep in touch that way. And my hope is that one day I will have the resources to travel out there and meet him, because I obviously can't thank him enough for what he did for me. And in speaking with him, he was so nonchalant about his donating cells, not specifically for me, but just to the registry, and he said he thought it was the thing to do, that maybe it could help someone out, and lo and behold, it helped me out. Physically, I feel terrific. I do have some very minor mobility issues, and that's okay. If that's the worst I have to deal with, a little bit of limping every now and then, that's fine. If I would have a friend, a family member, or someone I knew that needed to come somewhere for treatment such as I went through, this would be the first and only place I would recommend because of my personal experience. I can't say enough about everyone down here, from the doctors down to the lady who used to clean my room on the 5th floor in the unit. Everyone is just tremendous, caring, compassionate, and at the same time professional, experts in their field. I'm sitting here today in 2010, and a few short years ago, I didn't know if I'd be sitting anywhere. I feel blessed to have been able to receive my treatment at the Temple Bone Marrow Transplant program, and I say that from the heart.